I'm Lonnie Schiff-Ross, the Executive Director of First 5 San Joaquin. Today we're here to recognize and raise awareness of the expansion of the First 5 California Emergency Supplies Program and local agencies and key partners that provide resources to our community. Before we begin, I want to recognize our partners here this morning: Senator Susan Eggman, Dr. Maggie Park, a First 5 Commissioner, our Public Health Officer, and a pediatrician; San Joaquin County District 2 Supervisor Kathy Miller, a mother and a grandmother to 7 children under the age of 6; Jackie Wong, our Chief Deputy Director at First 5 California and a former resident of Stockton; Max Vargas, the Deputy Director at First 5 California and also a former resident of Stockton; Benito Delgado Olson, our Executive Director at supplybank.org; and Rebecca Ray, the Director of Community Relations and Development at Family Resource and Referral Center. While the root of this program here began locally with our diaper bank program with First 5 California, WIC, and supplybank.org, the pandemic enabled us to show how much support can be generated for this community when we all work together. This has not always been easy, so I want to express my sincere thanks to all of the organizations here for their commitment to our region's families and children during this difficult pandemic. Now, I have the privilege of introducing our first speaker. Let's all please welcome State Senator Dr. Susan Eggman. Thank you.
Good morning, everybody, and thank you, Lonnie. It is so exciting to be out here today as we undertake this expansion of being able to provide basic needs for people. We know from the pandemic that the basic needs for people hasn't gone away, and in fact has continued to rise. That is why it's so important for collaborative partnerships like this, where we leverage our federal money, our state money, our nonprofit money, and come together to be able to provide the very basic needs for families. We know without this kind of expansion, everybody who's lined up for diapers today would have to be looking for a different way to do that. And we know that if families don't have to worry about their very basic needs, they can focus on other things like their health, like their education, all kinds of other things that make our lives whole. But taking care of people's basic needs is a huge part of that. I was very pleased as the chair of Health and Human Services, the budget committee, that we're able to do as much as we were for diaper banks, for food banks, again, knowing that it's a symbol of anybody's society of how we care for the least of us. So it's my honor to be here today. And I can tell you throughout this pandemic, the people here behind me, we have all been working in collaborative partnership to do everything we can to leverage resources and to get them out and to keep people safe, and not just safe, but thriving. And so with that, I want to introduce our next speaker, who I've had the honor of working with. I named her my Woman of the Year because if anybody has really been on the front lines of this pandemic, it is our Public Health Director, Dr. Maggie Park.
Good morning. As a First 5 San Joaquin Commissioner, San Joaquin County's Public Health Officer, and a pediatrician, it is my pleasure to highlight this important effort for our community today. While our agency has collaborated before with some of the partners here today to address diaper needs and other unmet material needs, the pandemic made access to resources an even more urgent matter. It remains critical that our most vulnerable families and child care providers serving the children of essential personnel continue to have access to PPE and other items to protect their safety and comfort. That is why San Joaquin County Public Health Services WIC program provides operations like this to support the receipt, storage, and distribution of essential family materials. A special thank you to Kimberly Smith and her team for the incredible work they've done to make this all possible today. We are also appreciative of First 5 California and supplybank.org for their early leadership to support these efforts, so our local leaders such as First 5 San Joaquin, Public Health WIC, and 211 can continue to be trusted resources for our community. While this effort continues to support PPE distribution, it is also important to highlight that in the 4 years prior to the pandemic, there were 3,768 hospital visits related to diaper need, the majority of which were to the emergency room. That is why, with the continuing economic impacts from the pandemic, it is so important these efforts continue to help address diaper needs. On behalf of First 5 San Joaquin and San Joaquin County Public Health, I want to extend our deep appreciation to all contributors towards this expanded community effort here in San Joaquin County. Next, I have the pleasure to introduce our San Joaquin County Supervisor for District 2, Kathy Miller.
Thank you, Dr. Park, for the kind introduction. It's my pleasure today to highlight this collaborative effort between our state, county, and community-based partners. As a mother, grandmother, and leader of our county's Children and Youth Task Force and the San Joaquin Continuum of Care, I can tell you the importance of access to basic material needs for young children and families. It just cannot be overstated. I also want to echo what our public health officer, Dr. Park, said related to diaper need and its impacts on our hospital systems. As a member of the Joint Hospital Committee, I can tell you that ER visits for our infants are expensive, and they expose our children needlessly to other illnesses. Our feedback from the community suggests that diaper need and PPE, they're equal priorities. I just spent the weekend with all of my grandchildren, 6 of them under the age of 5, and I can tell you that diapers are a basic need. You can have enough diapers, but you can never have too many diapers when you're with a room full of little kids. I am very pleased to report that First 5 Emergency Supplies Program has provided in San Joaquin County more than 500,000 diapers and wipes, 353,000 units of cleaning solution and disinfectants, 251,000 masks, 236,000 disposable gloves, 8,000 units of hand sanitizers and soaps, 1,400 children's books, and 240 infrared thermometers. The impacts can't be overstated, the benefits this has provided to our communities, and we commend all of our colleagues and allied agencies for their role in this effort. So please join me in inviting the Director of Community Relations and Development at Family Resource and Referral Center, Rebecca Ray, to share some insights about the impact that our collaborative efforts have had on San Joaquin County community members. Thank you.
Good morning. Thank you, Supervisor Miller. I'm Rebecca Ray with Family Resource and Referral Center, your 2-in-1 San Joaquin County provider. It's great to be here today connecting families to local help and resources with our terrific partners. What is 211? 211 is a free and confidential call center that helps people across San Joaquin County find the agencies that can help them 24 hours a day, 7 days a week, in over 200 languages. 211 is for everyone, especially our local families who need to find resources like cash assistance, health or dental coverage, nutritional programs like WIC, childcare, education services, developmental screenings, diapers, food and housing, and so much more. Last year, like many of our partners, we faced an influx of clients looking for assistance as families lost their jobs, income, and faced housing insecurity. Our work and focus shifted dramatically as the pandemic crisis that accompanied it took a hold of our county. Over 2,424 calls this year identified as having children under the age of 5 in the household. The COVID-19 pandemic has continued to have lasting impacts on our families. Over 69,000 referrals were provided to San Joaquin County residents in 2020, and of those, 58% were for basic needs alone. 211 San Joaquin is your local guide who understands you and the community. When you contact 211, you're connected to a compassionate local expert, highly trained expert who can access help for families. It is our partnerships with organizations and government agencies that allow families in finding the right resource to rebuild. There are over 6,000 health and human services and programs listed in the 211 database. Accessing help is just one call or click away because of our 211 partners. Working with First 5 San Joaquin, our agency was able to provide hundreds of families with PPE, masks, diapers, and wipes, and other essential resources. We want to thank our partners, First 5 San Joaquin, WIC, Public Health, and Supply Bank for your continued support of 211 San Joaquin, our families, and our child care providers during this critical time. Partnerships like the one we have at First 5 San Joaquin allow our agency to continue to be the relief families need from crisis, while allowing us to continue our responsibility and mission to strengthen the lives of children, youth, and community through our existing programs. We thank all of our partners in this effort and look forward to continuing our work together. Next, please welcome Executive Director of SupplyBank.org, Benito Delgado Olson.
Well, good morning. My name is Benito Delgado Olson. I'm the Executive Director of SupplyBank.org. It's always wonderful to be out in the community at these type of events. I don't want to be redundant with anyone else's points today, other than to just introduce what SupplyBank.org is and does. Our role, collaborating with First 5 California and all of their local commissions throughout California, is to make sure that the trusted community-based organizations like the one that we're at today have the resources that they need, that they can provide to the communities they already know and trust. And so our job is to find those resources and get them to the places they need to go as quickly and as efficiently as possible. We're tremendously grateful to First 5 California and their association for really their early leadership ahead of several other state actors to make this happen. There are a lot of efforts working collaboratively towards this, just like what you see today all across the state. But really, it was the state commission, their association, and a variety of stakeholders, ourselves included, that made this happen when it was most needed. The last thing I'll say is that my understanding is that this was going to start at 11, but there's so many people here that they started early, which I think is terrific. But I think that really just underscores the need in the community of why this is so needed and must continue, and why we're so excited to be celebrating this expansion here today. So just want to thank everybody involved, all of the actors. And it's my great pleasure to introduce Jackie Wong from First 5 California.
Thank you, Benito, and thank you to everyone who's actually in service to our community. I am so grateful to be part of this movement to serve our children in San Joaquin County. As I mentioned before, I'm a former resident of Stockton, but I am always rooted here, and this will always be my home, and I will always fight for the voices and the children here in San Joaquin. My family's still here, my nieces and nephews are still here, and so this is truly my heart. So thank you for having me here. So foreseeing actually the coming shortage of supplies and price gouging, First 5 California, our association and our nonprofit partner SupplyBank.org did a statewide needs assessment of what we could do in February of 2020. We actually went to the commission and asked our commission to fund initially $4 million for the immediate relief in April of 2020, and invested yet another $1 million to establish the emergency supply program. Recognizing the ongoing crisis presented by the Delta variant and other factors such as wildfires and a number of other things, as well as young families, recognizing that young families and others were disproportionately impacted, we continued to do a needs assessment and realized that that wasn't sufficient enough. So we subsequently went back to the commission and asked for an additional $2 million to support this program. So now, the spring following a staff report, we realized that that wasn't enough, and we continue to do ongoing needs assessment to make sure that this is a fruitful program. I now welcome First 5 Deputy Director Max Vargas to share additional insight into our program.
Thank you, Jackie. I'm happy to report that in this month alone, the program has provided millions of items of PPE. That's disinfectants, various essential items, and other family essentials for families up and down the state. In fact, I have some of these figures on hand. That's more than 6 million diapers, 13 million wipes, just like what you see laid out here and what families are picking up today. This has been an ongoing effort with a steadfast goal, really an unwavering goal, to ensure that we're reducing community spread of the virus, that we're providing basically health and safety and comfort for childcare providers, for families, for children up and down the state, and in partnership with so many key stakeholders and organizations on the ground who know our communities best. That's the only way to make sure that it's getting out to families, that we see this sort of effective outreach, and we're proud to share in that effort and proud to be a partner in support of all this vital, essential, life-saving work. Other figures I have on hand is that we've provided more than 70 million items to families in need since this program has begun. So statewide, that's over nearly 31 million diapers and wipes, over 11 million masks, nearly 11 million disposable gloves, over 16 million gallons, not ounces, gallons of cleaning solution, nearly 381,000 units of hand sanitizers and soaps, over 219,000 children's books, because literacy is important, and we talked about resilience, and I think Senator Eggman mentioned earlier just how vital it is that we provide all the basic needs so that folks and families can thrive, not just survive, and over 12,000 infrared thermometers. So in total, the sum of all these parts is really an outsized impact on the well-being of families, on the well-being of children in our communities, particularly families who have been under-resourced historically, who need that extra support, who need that opportunity so they can not just stand through this pandemic, but thrive and get to a better place. So thank you all. I thank the partners, and I'll hand it back over to one of our key local champions, Lonnie Schiff-Ross, the Executive Director of First 5 San Joaquin.
So thank you, everyone. A special thanks to all of the people going up and down the stairs and ramp to deliver the supplies. But the real heroes today are the people going through the drive-thru, and the parents and grandparents and caregivers that have gone through such tremendous opportunity, or had tremendous opportunities, especially in the last year and a half. So our heroes are the ones that are in the car. Thank you all. I am so grateful to be working with everyone. Just want to end it with #blessed and grateful. Thank you.